Hello, this talk is about the combined influence of racial and income segregation on mortality across US neighborhoods. I start providing some motivation for this research. Racial segregation has been regarded for a long time as a fundamental cause of racial disparities in health and mortality. And income segregation has gained increasing importance in the last 40 years, as income inequality in the US is growing rapidly. We link segregation and mortality at different geographic levels based on two conceptual frameworks. The first relating segregation with health and neighborhood conditions, while the second indicating that segregation modifies social capital for a whole area with differential effects across racial groups. However, only a few studies have explored the interaction between racial segregation and economic conditions across neighborhoods in rural and urban areas. We aim to contribute to fill this research gap by examining the combined effects of racial and income segregation on mortality rates at ages 45 to 74 across US urban and rural neighborhoods. For that, we tested 5 specific hypotheses. The first states that average mortality rates are higher in neighborhoods with high concentration of poverty relative to those with higher concentration of affluence. The second, that average mortality rates should be higher in neighborhoods with a high concentration of minority population groups relative to those with high concentration of whites. Third, neighborhoods with an unequal distribution of minority residents relative to whites have higher risk of mortality on average. Fourth, we hypothesize that isolation of minority groups can be associated with lower rates of mortality in minority-majority communities, in line with the ethnic density effect hypothesis, in which more favorable health outcomes are observed among individuals from ethnic minorities that live in areas with a higher concentration of their own ethnic group. Finally, we evaluate whether the probability of death should be higher in communities with higher exposure to poverty, but more detrimental in communities with larger concentration of minority groups, and whether the opposite is true in affluent communities. Data for this research are from the 2011 to 2015 period live tables by census tract from the Vital Statistics, with around 67,000 tracts in more than 3,000 counties nationally. Then we constructed residential segregation indicators at tract and county levels from population counts, but race, ethnicity, and income levels from the American Community Survey. The main outcome for this research is the probability of death between ages A and A plus 10, and we restrict our sample to age groups 45 to 74 to focus on premature mortality. We measure residential income concentration at the tract level using 2 indicators. First, using 4 race ethnic groups represented by whites, Hispanics, blacks, and other non-white minority populations. We classify tracts according to its racial and ethnic majority group and get a ranking indicator with 4 categories. Second, we use the index of concentration of the streams constructed using the number of affluent and poor people in the tract, with values close to -1 indicating higher concentration of poverty and those close to 1 higher concentration of affluence. Using these indicators, we stratify our sample in 5 groups. Here, I show the geographic distribution of neighborhoods in the first group, which concentrates 89% of the total white population nationally. And within this group, 80% of whites and 39% of affluent. Dark colors indicate higher concentration of affluence as measured by the ICE quantiles, and lighter colors indicate higher concentration of poverty. Here we see that Hispanics are more concentrated in California, in states near the border with Mexico, and in South Florida, in neighborhoods mostly characterized by moderate concentration of poverty. Within this group, we have around 72% of Hispanics living in these regions and with 44% of poor residents. Neighborhoods with high concentration of Blacks, which are comprised of around 74% Black residents and 52% of poor residents, are mostly situated in the South and the East Coast and in large metropolitan areas such as Chicago, Milwaukee, New York, and Philadelphia, mainly neighborhoods with high concentration of poverty. Finally, minority-majority neighborhoods are also distributed across the whole territory, where Asian and indigenous majority neighborhoods in particularly are dispersed and located mostly in West and Midwest regions. Now I show the explanatory factors at the county level, where we assess 3 different indicators of residential segregation. First, the index of dissimilarity or minority-wide unevenness measures the percentage of minority or white populations that will need to be redistributed across census tracts to achieve an even residential distribution. It ranges from 0 to 100, and higher values indicate large segregation. Second, the index of isolation measures the extent to which minority members are exposed only to one another. And the index of exposure to poverty or affluence measures the extent to which members of a minority group are more likely to be exposed to poor or affluent members in the same community. Both are computed as minority weighted average of each unit minority or poor affluent proportions. And values close to 100 indicate higher isolation or exposure to poverty or affluence. For statistical analysis, we use 3-level random intercept models with census tracts in the first level, within counties in the second level, and states in the third level, and with random parameters capturing the residential variation at each level. Since the objective of this research is looking at the combined effects of racial and income segregation at different geographic levels, we use 2 main model specifications. In type A models, we include income and racial concentration at the neighborhood level, and racial segregation measured by unevenness or isolation at the county level. In type B models, we look at the interaction between race and income using the index of exposure to poverty or affluence. And we conducted stratified models by race ethnic concentration for a better assessment of race effects. Here I show results supporting our first hypothesis, which indicates that compared to neighborhoods with high concentration of affluence, the most deprived neighborhoods had a higher probability of death, or around 7.2% nationally. These results remain true in rural and or urban neighborhoods, but it was significantly larger in the poorest urban than rural neighborhoods. Our results on racial ethnic concentration also support our hypothesis of higher mortality in communities with high minority concentration, but the magnitude of the association differed depending on the racial ethnic composition as well as by rural and urban setting. For instance, compared to white majority neighborhoods, the association was substantially larger in Black majority neighborhoods, particularly in urban areas. We also found evidence consistent with the third hypothesis, with the positive association of minority white unevenness and mortality, particularly for residents living in neighborhoods with white or Black majorities. In a separate model, we see that minority isolation was negatively associated to a higher probability of deaths in neighborhoods with Hispanic or minority majorities in both rural and urban tracts, although with no significant difference between them. Further research is needed, though, in the case of Hispanic populations to see if this is related with the social support hypothesis, which asserts that Hispanic possesses strong family ties that help them build a sense of community and potentially contributed with a better health. Finally, we found that irrespective of the racial concentration, a higher exposure to neighborhood poverty had a positive association with the neighborhood probability of death, but decreased with a higher exposure to neighborhood affluence. The effect size was particularly high in Black and minority majority neighborhoods and in urban compared to rural areas, irrespective of the racial ethnic composition. Conclusions. We show that differences in survival across race ethnic groups are reflected across communities as they are concentrated in rural ethnic enclaves across U.S. territory. We found that racial segregation is an important predictor of differences in neighborhood survival and can have negative or positive influence in negative mortality levels. Finally, we showed that minorities with a higher exposure to poverty was associated with larger neighborhood mortality rates. And the opposite is true with a larger exposure to neighborhood affluence. I end here acknowledging my co-authors. Thank you.